Just a quick review of the BraceAbility lower back brace. A couple of things I really like about this one. The first one, you can tell right off the bat, is these removable suspenders. And basically, what's the purpose of those? Well, if you've ever had a brace that you just, like an elastic brace you put around, sometimes it can slide down on you. So these suspenders are designed to keep it up so it won't slide down. So if you've ever had that problem, this would be a good choice. However, if you like the brace but you don't like the suspenders, you can just take those off. They're totally removable. So that's a nice feature. The other thing is it's got these rigid stays on each side. Can't really see them well here, but they're inside the fabric. And basically, well, I wouldn't say this is a super rigid brace. This makes it a little kind of semi-rigid. Gives you a little bit more support than your average elastic corset that you just, Velcro around your waist. So I really like that too. And the other thing is, it's got two sets of straps. So when you put this thing on, first you put the first one around, and then there's a second set that Velcro around, and they all Velcro. And this is where you really can increase the tension. So that outer strap on the outside, you can really pull and get about as much tension as you want. So it'll give you a lot of firm core support with that outer strap. If you've ever had just a regular corset where you just go around once, it's kind of hard to get it really tight. So this works really well because the first one you just kind of put on, get the brace where it needs to be, and the second one really gives you that tension. So this is a good thing to consider. So if you have back pain, you want, you're going to be lifting a lot, give you a little more support in your back. I think this is a good choice. The only thing I got to tell you, if you do have a lot of problems with your back, or you want to prevent a back problem, there is a lot of research now on this muscle called your multifidus. So you have a lot of these little multifidus muscles in your low back, and actually all the way up your spine. To your neck, you have multifidus muscles. The main job of the multifidus is to support and stabilize your vertebrae. So they're finding a lot of people with back pain, like chronic back pain, herniated discs, arthritis in their back, spinal stenosis, chronic low back pain. When they get looking at the multifidus muscle in their low back, they find it's usually smaller than normal. It's not conducting as well as it should. Especially if you had back surgery, the thing's really not conducting well because they cut the small nerves. And also, and they find that if you take something like chronic low back pain, you strengthen the multifidus muscle, the pain goes away. So also there's studies showing that it also prevents future episodes of back pain. So not only can it treat back pain, but multifidus strengthening exercises can also prevent future episodes of back pain. If you're looking for a resource for that, probably the best one I know of is Treat Your Own Spinal Stenosis by Jim Johnson PT. The book's been out a while. I'm still getting great reviews. Has a nice section explains the multifidus muscle and how you can strengthen it so you don't have any back problems. So if you don't have spinal stenosis, this is just a great chapter on the multifidus that I've really ever read that'll teach you all about it. Anyway, so strengthening your back will give you internal support. The back brace will give you external support. So yeah, I think if you're going to consider a back brace, I think this is a good choice. So check it out.